Coping is defined as a set of responses to adversity and to the distress that results. Some characteristics of coping are that there are a set of responses occurring over time between the environment and the person. Coping has a relationship with stressful events, and it's a dynamic process, which is a series of transactions between personal resources and environmental resources. So, breadth of coping is the emotional reactions and the actions taken to confront that stressful event. So, all coping has some sort of breadth. There are psychosocial resources that can affect coping. One is optimism. So, having a positive mindset and strong personal resources can help people handle stress better and stay healthier. People that are optimistic generally expect good things to happen, and so they're more likely to cope with stress effectively and show healthier bodily responses. Typically, optimism is linked to lower blood pressure, less stress hormone activity, and reduced inflammation. Another important psychosocial resource is psychological control. So, the belief that you have influence over what happens in your life is a level of psychological control. This could be personal control, self efficacy, which is the confidence that you have in succeeding in a specific situation, or even collective control, where you work together with friends or family, and you have this sense of control that you can work together and make good things happen. Feeling a sense of control not only improves emotional well-being, but it also supports healthy behaviors. It can protect the body from stress-related problems like poor immune function and heart disease. Self-esteem is the way that you value and feel about yourself, so it can help people cope with stressful situations, and it's linked to better health. High self-esteem may reduce stress responses in the body and encourage healthier habits. And then finally, resilience is the ability to bounce back after having a very difficult experience. People with resilience generally bounce back from stressful situations, or they are able to adapt effectively to that stressful event. Things like having a sense of purpose in life, or finding humor in tough situations, or even trusting others could all help people adapt and become more resilient. Resilience has also shown to be a protective factor in stress and health outcomes. So coping is determined by coping style. So everyone has a particular coping style that they use in order to respond to a difficult situation. So the style is the propensity to deal with a stressful event in a particular way. And there are different types of styles that people have for how they deal with certain things. So one is using the avoidant coping style. So you're coping by avoiding the situation entirely, which is the least effective. Although it provides instantaneous relief, it does not provide relief in the long term. So an example of avoidance coping would be consuming alcohol or abusing drugs or medication. Number two is the approach coping style. So that's coping by gathering more information or directly taking action. So this tends to be a more effective coping style and has shown to serve as a protective factor against stress and health issues. And then there is problem-focused coping, so attempting to do something constructive about the situation. So once you have information, if you have enough information, you try to directly deal with it. So this is effective typically when one has control over a situation. So like a work-related problem, it may not be as effective if one has no control over the situation at all. And then lastly, there's emotion-focused coping, which regulates emotions that are experienced due to the stressful event. So this works for situations when one does not have control. And so all of these different coping styles are adaptive, but they do depend on whether or not the situation is controllable or not. So emotional approach coping focuses on clarifying focusing on concentrating and working through the emotions in response to a stressful event. It aids in adjusting to chronic conditions and medical conditions. So research has shown that people coping with HIV, when they use emotional approach coping, this helps lower stress levels and promote better health behavior. It also helps manage stress better. And so when one does not have control and one is, let's say, has a chronic condition and they're not able to really control the condition or the diagnosis is permanent, emotional approach coping tends to work the best. Then there's proactive coping, which is anticipating potential stressors and acting in advance in order to either prevent the stressful situation from happening or to minimize its impact. So it helps prevent stressors and reduce their impact. So one is focusing on the ability to anticipate or detect potential problems. People that proactively cope can manage them through their coping skills and they self-regulate. So a lot of it has to do with having a perceived control over the event, directly dealing with it and correcting actions in order to reduce the impact or prevent it from happening again. Acceptance and commitment therapy, also known as ACT, incorporates mindful awareness and acceptance, and it provides cognitive insight into the nature and control of stress. So with this type of therapy, you're looking at this stressful situation and you're trying to gain more knowledge and insight as well as more information about the event. So the nature of the event, how much control do you have over the event, and what are some things you can do about the event? So it teaches individuals to accept the problem for what it is, be aware of its occurrence and the conditions that are causing it, and changing your behaviors to reduce its impact. Expressive writing lowers psychological and physiological indicators of stress. It aids in effective coping. It helps organize thoughts and find meaning. It helps to focus attention on positive aspects. It provides an opportunity to clarify emotions and affirms one's personal values. Self-affirmation also improves coping strategies. So, for example, self-affirmation is recognizing your value and the value of your self-worth, which helps individuals feel better about themselves and the situation. It lowers physiological activity and distress. And so, for example, a study on self-affirmation looked at people's responses to an exam when they used forms of self-affirmation, and they found that it lowered their distress levels, but also lowered their physiological activity. Self-affirmation undermines defensive reactions to health threats. Relaxation training affects the physiological experience of stress by reducing arousal. There are different types of relaxation training that focus on deep breathing, progressive muscle relaxation, guided imagery, transcendental meditation and yoga, and self-hypnosis. Relaxation training reduces heart rate, muscle tension, blood pressure, inflammatory activity, lipid levels, and it reduces anxiety and tension, which reduce other physical and psychological activities associated with stress. And so it does come with a lot of physical and psychological benefits. Coping effectiveness training draws on principles from cognitive behavioral therapy. By using cognitive behavioral therapy, you can focus on identifying the stressors and then trying to reduce their impact. And so a lot of this coping effectiveness training really depends on how you appraise an event and disaggregating the stressors into specific tasks. So part of CBT is finding out the event and appraising it, evaluating its stress level and how impactful it is on you, and sort of breaking and disaggregating it into specific tasks for how you're going to deal with one task at a time. Coping effectiveness training also involves setting realistic goals. So rather than seeing the stressor as a form of stress, seeing it as a challenge. And so trying to either eliminate the stressor or modify your reaction to it by turning it into some sort of challenge or goal. And once the goal is set, specific behaviors to meet those goals are identified. So what behaviors are you going to change of your own to try to make an accomplishment or goal out of the stressor? And then it also involves engaging in positive self-talk and self-instruction. So self-encouragement and instruction can change the behavior, either eliminating the stressor or doing exposure. So taking steps to figure out, again, what you can control. And if you can't control something, trying to change your reaction to it or exposing yourself to it, accepting it, and then finding out what you can control as part of the stressful event and changing your behaviors accordingly. Other CBT strategies involve time management and planning. So if you have a stressful event coming up, establishing priorities regarding the stressor. So what is urgent and what is not urgent? Avoiding time wasters and learning what to ignore. And so this will help with a lot of time management tasks and skills that you can build. So if something is stressing you out, just focusing on what do you want to make a priority and what is it about the stressor that you can't control and what is it about the stressor you can't ignore. So how effective one's coping strategy is depends on whether the person makes attempts to reduce or eliminate the stressors, tolerating or adjusting to negative events or realities, maintaining a positive self-image, maintaining emotional equilibrium, continuing satisfying relationships with others, and enhancing recovery when ill, and also keeping healthy physiological, neuroendocrine, and immune reactivity.